Welcome to Harsh Life Humor, where we say life sucks, laugh anyways. My name is Kelly, and I'll be discussing the cold reality of things in a way that allows you to laugh through the struggles because sugarcoating is for candy. A little bit about myself. I just turned 29, 11 years, 25 pounds, and 1 kid ago, and I've learned a lot of hard lessons that I wish I had learned sooner. Now, I am a doctor of physical therapy. As a kid, I was in the Gates program. In high school, I was in honors classes. I graduated summa cum laude from undergrad before getting my doctorate degree at age 26, somewhere between 3 and 14 years ago. So you may think that I am smart, but you would be so wrong. At 22, I did one of the stupidest things a kid can do. I got married. Thank you. I've been happily divorced for 3 years now. I also spent $150,000 on a degree that earns me less than $100,000 a year. Now, at one point in my life, I was considered pretty good at math. But if you spend more on a degree than it will make you in a year, it's a bad investment and a poor financial decision. You will be paying for it for the rest of your life. Now, I'm serious, for the rest of your life, really, forever. You will die and you will still owe money. Your kids will owe money. You will be paying forever. Okay? To really make my point, at this point in my life, I have paid over $100,000 on what was originally a $150,000 loan. I still owe, wait for it, $135,000. I'll let you do the math on that. Now, I have been working as a physical therapist for some time. In fact, I have been a credentialed clinical instructor for over 10 years now. And in that time, I have considered it my duty to crush the dreams of my students by sharing the brutal truth about working in the medical field. However, by the time they reach me and they're on their clinical rotations, they're kind of past the point of no return. So with that in mind, I have done my best to share the honest reality with dozens of PT aides that I have worked with before they get accepted to grad school and ruin their financial future. But this is all kind of small scale. It's estimated that 12,000 DPT students graduate each year. So it seemed only fitting that my first video should be dedicated to providing the truth, the whole truth, and nothing but the truth to all prospective DPT students so that they can make an informed decision about choosing to be broke forever. So let me start with some background. People always ask how I got into physical therapy. And it is the same basic story you've heard 1,000 times before. I got hurt playing sports in high school and I was sent to physical therapy, where the therapists had me run on a treadmill while they sat in the break room and ate brownies that a patient had brought them. Right then and there, I looked over at them and I said, I want that job. True story. There are significantly less brownies than I had anticipated. So, also, when it comes to patients, I assumed that most patients would be like me, a young high school athlete with an acute surgical injury, the holy grail for physical therapists. But as it turns out, most patients are old men with degenerative back pain and stories that start with, back in 1956, followed by my rubbing their butt for 20 minutes for the next 6 months. Even that might not be so bad if you had respect and proper compensation. However, despite my $150,000 doctoral education, I still hear patients asking if I had to go to college to do my job. No joke. One person told me they thought it was just a weekend course. This was just yesterday. It never gets old, right? Now, it may clear things up if PTs went by doctor the way that chiropractors do. However, since physical therapy was not always a doctoral education, there are still PTs practicing out there with their masters, and some of the older ones even just have a bachelor's degree. So, you can imagine that these older, more experienced PTs are not exactly thrilled about the idea of calling a new grad with no experience doctor while they don't get called that, right? So the respect thing is kind of non existent. But surely we make good money, right? That's the funniest part of all, right? The insurance companies also reimburse the same, by the way, whether you have a bachelor's degree, a master's degree, or a doctorate degree, they don't care. So, as far as the insurance companies are concerned, you have a bachelor's degree. Um, so, yeah, no, there's really no money. Now, when I was in high school, somewhere between 11 and 22 years ago, PTs made okay money. What I didn't realize at the time was that they would be making the exact same amount of money 20 years later, despite the fact that the cost of living has practically doubled. And to make things even more challenging for myself, I live in California, where the overall cost of living is about 45% higher than the national average. Now, I'm going to be really transparent here. As a PT, I bring home about $5,600 a month. Now, according to financial experts, your rent/mortgage and utilities should only be about 30% of your income. And according to the 50-30-20 rule, 50% of your income should go towards needs, 30 towards wants, and 20 towards savings. First, let me say, my rent/mortgage is about 75% of my income, which already blows both rules right out of the water. Next, if I add in things like car insurance, daycare, student loans, my, my needs without food are 112% of my income. Now, I guess food could be considered more of a want than a need, except for some reason the government seems to think it's necessary for me to feed my son, so there's that. Anyways, clearly the math ain't mathin'. There's obviously nothing left over for savings, investments, or frivolous wants like food or clothing. And forget retiring, you will work until you die, since you have nothing left over to invest in retirement. Keep in mind that this is a physical job, and massaging old men's butts for 10 hours a day will eventually wear you down, making it really challenging to keep up this type of work well into your 90s. This is why nearly all PTs my age or younger, especially in California, have multiple side hustles. I, for one, am up to 7. Now, if you're lucky, you marry well and you might be okay. But if you're single and you have kids, you're screwed. The other recommendation would be to have rich parents. Okay, so I've covered the no money and no respect, but surely it's a rewarding job. Did I mention the rubbing old men's butts for 20 minutes? Yes, you can truly help some people. However, most patients have chronic degenerative problems that can't be undone and are serial repeat offenders, coming back year after year for Medicare paid massages and free personal training without any desire to have to do any exercises on their own. Then there is the nature of the job itself. Unlike other jobs, with a flexible schedule, the ability to work from home, physical therapy is about as rigid and unforgiving as it gets. You are scheduled often a month in advance with set hours. If you get sick, too bad. Get your ass to work or you will be canceling up to 18 patients in one day. I have literally left in the middle of an evaluation to throw up and then go back to the evaluation. That is not a joke. That is true. That is really, really true. And by the way, if your kid has a parent-teacher conference, IEP, back-to-school night, etc., they better let you know about it at least a month in advance so you can block your schedule. Hint, they never let you know about it that far in advance. Usually I get an email about 1 week in advance, and then it's like, well, I'm booked solid next week, too bad. There is no coming in late, no leaving early, no working from home, no making up, hours on nights or weekends. Plus, most outpatient clinics are open until 7 o'clock so that people can come after work, which means you are working late every night. Good luck finding a daycare that stays open that late. Lastly, Due to decreasing reimbursement rates from insurance companies, PTs are having to see more and more patients. The good old days of seeing a patient one on one for an hour and having aides, enough aides to help you throughout the day, that exists now only in memories. Hmm. Documentation time has also been cut to add room for more patients, meaning it's now common for PTs to document from home on their own time, which decreases what would be considered their hourly earnings. Many clinics have also turned to gimmicky ways to bring in more money, including selling supplies to patients that they can easily get for cheaper on Amazon, and selling things like alkaline water or cash pay treatments with new gadgets that insurance companies don't cover. Now, despite sharing all of this information with many PT aides, I have been unable to successfully deter any of them from pursuing a career in physical therapy. So, lastly, me remind all of you who may still be considering a job in PT, there are substantially less brownies than anticipated.